All right, so I have two ladies here from the new parent support group organized by ACS that are here to talk to us about a new program they got going on because of COVID-19. So, what is this new working group and who is involved?
So this working group is actually a collaborative effort between the Vicenza Health Clinic and ACS's new parent support program, Home Visitors. So our goal with the working group is to reach out to the expectant community, the families in our community, to offer them up-to-date and reliable information without them having to source it from social media.
Okay. And so you said it's a joint effort between ACS and the clinic.
Correct.
So that's your who is involved. All right. Why did this group get started?
This group got started at the direction of Garrison, and it got started because we felt that the expectant families needed a more reliable source of information than just social media and other people's responses. So the goal is to give accurate, up-to-date information on the changes occurring due to the COVID-19 pandemic.
Okay. So what's the focus of this group?
The focus of this working group is to bring together the nurses from the clinic and the medical professionals at New Parent Support Program to channel the information from the source directly to the families in our community, really letting them know that they've been heard and that they have people advocating for them.
Okay. So what do you hope to accomplish?
So the ultimate goal, I think, for this is to give the families the direct information so that they're not having to get it from a second source or pull it from social media, giving them the direct up-to-date information and knowing that they have someone that they can contact with their concerns and that they'll be listened to.
Just basically having someone like directly in their corner to get that information from.
Yes.
Okay. So have you contacted all expecting mothers in the community?
We are beginning our calls. The parents should be expecting their phone call within the next week.
Okay.
We are only tracking the expectant parents that have had an OB referral done at the clinic. So if they are seeing an OB professional, a physician that's off post, or if they have not yet had their OB referral done, we're not tracking them. If they would like to be added to our roster, we of course want to reach out to them as well.
Right.
And all they would need to do is to give us a call.
Okay. And then you said they could also organize it through their SFRG, right?
Correct.
Okay.
Each of the SFRGs have been given our contact information as well as the bullet points for this, so they're aware, they know who to reach out to.
Okay. So what do you think are their biggest concerns?
We felt after looking at the Facebook post and the comments on Facebook that the biggest concerns were that people felt like they weren't being listened to and that they weren't being heard. And we hope to alleviate some of that concern by letting people know that Garrison has heard you and addressed everybody individually and personally so we can cater support based off of the family's needs.
Okay. Is there anything else that either of you would like to add that I haven't asked already?
So while right now Lindsay and I are tasked to be on this working group along with the clinic, I would like to let people know what New Parent Support Program does on a regular basis.
Okay.
We are here to provide education and tools to the military community, the DoD civilians and their families, hopefully to alleviate some of the normal stressors that go along with parenting. And we do that by offering classes and playgroups and home visits, of course, so that we can meet them where they are and offer them some tools to put in their toolbox to help them deal with things like potty training and temper tantrums and sleep issues and breastfeeding. So unfortunately, because of COVID, we are not able to make home visits or to do our classes or playgroups in person. And we miss you. But in the interim, we are absolutely available here for you, for all of the families in our community, just to reach out. Unfortunately, it's by phone at this point, but we're here.
Okay, so if they wanted to coordinate an appointment or something like that with you over the phone, what is the number they would call?
They would call +39 349 273 5764.
All right. Is there anything else you want to add? All right, I want to say thank you, ladies, for coming out, and we appreciate everything you do for the community.
Thank you.
Thank you.